Welcome back to Self-Carapist Therapist. I'm your host, Lorraine Moorhead, and today's episode is all about ART or Accelerated Resolution Therapy. My guest today is Laney Rosenzweig, a licensed marriage and family therapist of almost 3 decades and the developer of ART. If you enjoy this episode, please be sure to follow and subscribe on your favorite podcast platform and head over to selfcarapist.com to subscribe to the newsletter. Thank you for joining me, Laney.
Sure, thank you.
I'm so happy to have you. Can you take me back to the beginning of ART and explain how you came to develop it?
Sure can. So I also have a book called Too Good to Be True on Amazon. And so I had a stroke 3 or 4 years ago, changed my voice. However, so what I did was build a training room out of my home. I still love to train. I do everything. I do consults on the web. We do conferences. Everything is like I do more of it, actually. So my brain's fine. It was just the voice as it affected my right side. So in 2007, I took EMDR training because I was working at a clinic for over 30 years. And someone said at a police station when we went, because there was a suicide, "Do you know EMDR for trauma?" And I said, "No, but I should. I'll sign up." So me and a few people signed up, and I begged them to have it because there was nothing around here. And they did. And I went to the training, and I fell in love with the eye movements totally because they move things to the positive, right?
Yes.
But I did not like the protocol. I found it difficult. I didn't know how it would end with a session. I tried it one time the free association way. I said, go with that, go with that, go with that to the client. He said, go with what? And I said, I'm not sure. I think it's the last thing you just thought of. And I thought, I am terrible at EMDR. I don't know how this will end. It happened to end good, where he saw a good church over the church with the bombing. Luckily, and I said, I don't want luck. So I thought to myself, what if I took the eye movements and put them right on the problem? Just do your problem. I was going to do eye movements, take away the sensations periodically. I'm going to make it much more uniform and find a way for it, see if it will work better. So I did that. And the results were trauma was being done in one session. I even did OCD, one session. I couldn't believe it. I said to the client who had 10 OCDs, when he came back 3 weeks later, how many of those do you still do? He said, none. As soon as he did that, it was over. So I was like a shock. I said, are you kidding? So you don't want to, I teach my people I train, don't say, are you kidding? You're supposed to appear like you know what you're doing. That's the truth. So anyway, the results were unbelievable. And when we were in a group for the training to discuss how it was going, I raised my hand. I said, you should have seen what happened. This woman lost her rabbits in the basement. I did the session. She left happy and she was okay and breathed normally. It was great. Everyone else in the group was having problems. Her hands were raised. I have a problem. So I would raise my hand. You should see what happened in this session. And the person said, would you please give someone else a chance? And that was it. So I didn't feel like I belonged. So I went for a supervision with EMDR supervisor. And I told her what I did. And she goes, look, I don't know what you're doing. And I don't want to slap your hand too hard. But either do it our way or call it something else. Because whatever you're doing is not EMDR.
Yeah.
And I wrote home and I thought, but my results are so good. They're so good. So I decided that I was going to create something new. And I put words on the kitchen table, and I picked out accelerated because I know it's fast, resolution because it seemed to resolve things in a session, and it's a therapy. So I did, and I thought ART, they may confuse it with art, how the other art. And I would like to make a t-shirt, someone's doing it for me, that says accelerated resolution therapy, the other art.
Love it.
Right?
Yeah.
So at this stage, we have, it's 18 years later, we have about 80 trainers going around the country and outside the country in Spain, other places. And so we have maybe 18,000 training groups of small groups, 10, 12, whatever. So we have studies going on at Mayo Clinic. They have an NIH grant to study grief, to try to immediately get rid of the grief before it starts with caregivers who are going to lose people in the hospice. They want to do a study on sleep as well. They have done some other things with cancer in the past. I've trained 3 times at Yale University, which is close to me, so I travel there. It's only an hour away. And the military in Canada is doing a study, like more than halfway through. So people are recognizing this is pretty amazing. Now, I will tell you that trauma I can always do, even a whole childhood trauma in an hour. Ongoing things like eating disorders, substance abuse, they're difficult for any therapy because they have urges and cravings and secondary gains, right? But we still do it much faster than anyone else can do. So we may do that up to 5 sessions. Yeah, so it's very quick, but it's very, very thorough. Because the thing that we do that no one does as well as us is we erase negative images in the brain so you can't see them. So my theory, what I believe is negative images cause triggers. If you can erase them, the triggers go away immediately. Like going to a dentist, getting rid of decay, they put in a good filling, you're done. So we go in, get rid of the images that are causing problems, and that's why we're done so quickly. We put in the good images, I call it positization, my word, to positize. Until basically that's some of the differences. I did do a paper on the difference between EMDR and ART. I wrote a paper using Francine Shapiro's words, and that's on our website. Okay. It is, which you can put at the end, but it's basically artworksnow.com. It works as one of the things I'll tell you is that EMDR people I train have normally changed it away from the 8-phase model Francine Shapiro wanted and made it easier, and they've all done different things with it. So whereas ART is pretty much scripted, you know what to do. When you're talking to an EMDR therapist, you don't know exactly what they're doing because they've changed some of the difficulty to make it easier so people don't leave upset, as often as they can with the EMDR.
Yeah. Okay. Well, I wanted to just say, I think that's remarkable, the modifications that you've made since your stroke. And I'm not surprised to hear now you're doing even more work because all of your work is accessible from your home office. I am glad that you're still able to give these lessons to us.
Right.
So it's so interesting to hear that there were initially pieces of your initial EMDR training that you really gravitated toward and elements that you immediately found may not be a fit for your client and that you figured out so quickly. I think that really speaks to your maybe personal resilience that you were able to so quickly figure out what pieces you wanted to use and which pieces were not going to be a fit in your long-term work.
True. It was very just done this way I thought it should be, just not by any. I think Francine took other models and modeled her EMDR after blank slate and psychotherapy stuff, and I just did it innately, just by intuition.
Yeah. Yeah. I guess I do see she had that moment that she talks about in her writing about being on the walk and implementing the eye movements. And so I can see that piece that maybe one piece that the two of you had in common about kind of an innate understanding of what was going to be helpful.
Yeah, the other thing that is different is because I can control how I want the scripts to be, I can do things EMDR can't. I figured out a way to do ADHD with no meds, and we do reading dyslexia because people weren't reading that well when I do train. Sometimes I see that we can fix that. So we have other types of things we can do, not just trauma. When people take the advanced 3-day training, they learn all kinds of different things you can do with the eye movements.
Oh, interesting. So on the topic of eye movements, I know with I'm EMDR certified myself, but this platform gives me the ability to learn all kinds of different methods that people are using. So I basically want to deep dive all of them. I love to hear it. So EMDR now uses a lot of different methods for bilateral stimulation besides eye movement. Is that something? Are you strictly eye movements with ART?
When I teach, it's strictly eye movements, but if someone wants to do tapping or use the EMDR light bulb in their own practice after, that's fine. I find the eye movements the key, and I do just the right amount, not to flood, but to get people to actually be able to use it to we can desensitize the client in the first 10 or 15 minutes. Then we go on in this good dream to make it positive. So we do what EMDR sets out to do in the first beginning of a session. So it's very quick, as I say, and very thorough. So different in that regard. And I do train a lot of EMDR people.
Yeah.
Maybe 25% of it, all we train is EMDR, and they see the difference and gravitate to this because it's not sort of guessing or happenstance. The script works to get people from a sudden subjective unit of distress from even a 10 to a 0 very quickly as they reassess the issue in their brain, using both parts of the brain. Using the prefrontal cortex of thinking brain, the amygdala and the limbic system, and we're also trying to make it pleasurable. So a palmetto bug phobia, when I was in Florida, becomes the favorite singing star, Willie Nelson. And at the end, she said, "Should I kill Willie? Oh, I'll just take Willie outside." Whereas before, she was screaming on the top of her desk because there was a palmetto bug. So we try to add humor and make it fun in different ways that we do it. And people find it, the therapists that train find it to be actually fun. And I don't know another therapy that you can say that about pretty consistently, right?
Yeah. So that palmetto bugs to Willie Nelson, that sounds like the positizing that you were mentioning earlier.
Exactly what we do. And the brain lets go of the negative image, and we can reinforce the what the client chooses. It's always up to the client. We don't force anything, but it has a good ending, a good outcome. Each session, even if it's longer, because it's an ongoing problem, each session has a conclusion to it. So people don't walk around like the wounded dead, going around with being activated with no resolution.
What are the early elements that a therapist will learn in the training? What are some of if you could give a sense of what they could expect from the script?
Right. So I believe the script takes trauma and turns it backwards because it skips the thinking brain when you have trauma. So we take another look with the script at let's look at it again. Let's take away the negative sensations. So when you see it, the brain will already have changed it. And then we'll talk about what you want to do with it now that it is different, right? And then we talk about confidence building and looking into the future as how you want it to be. It's got steps. Each one is labeled, it has a step. It's very precise. And each step does something different that aids in taking apart the trauma so that the person looks at it from an adult view to the earlier self, I call it. So your earlier self is going to get a dose of the adult view and reassess it, but do it in a session. So it's not going to take 30 sessions or weeks or months or years. It's not necessary.
Yes. That part is so important, right? Because so many of these issues that our clients are coming to us with are programmed with the understanding of a young brain. And so it's interesting to hear that you're kind of sending it back through maybe a more sophisticated brain with more of a vast understanding and allowing it to be understood.
And right. And I remember training out. Well, I've trained at over 13 bases. When I went to Walter Reed, the head scientist was shocked that he could learn this because it was like his holy grail, I think, because he followed us around and said, "Oh, how'd you come up with something that has all the elements you need for a trauma-based therapy?" I said, "I don't know. I just did what I thought was right." And he used it it may still be using it for a long time. I mean, we trained it for Belvoir, for Hood, for Benning. I mean, I went to all the bases trained. They loved it. They couldn't believe this, here exists now. So, and my people I train are so happy to teach this to people. So you have a method. So we're looking at colleges because if they can get this training in before people leave or graduate a master's program for therapy, they'll leave with something for trauma instead of not knowing what to do.
Yeah, so that's a question that I'd love to talk about a little bit more. It sounds like you believe that as a foundational model, this is a good one.
I think it's the best one. Of course, I'm the founder, so what am I going to say? I think Francine Shapiro is a great woman to bring the eye movements into the modern world. I just think she went one way to free associate, and I thought, no, I want something specific that will work. I don't want to free associate because dreams, REM sleep, which eye movements have, they don't solve things. We go to bed, we don't wake up with an answer most of the time. But so I tell my therapist, if REM could do what ART does, we wouldn't need therapists anymore. Because you go to bed, it would do the script, and you wake up with the answer. That'd be it. I don't mean to scare my therapist, but it's probably true.
Yeah, I see what you mean. And I'm going to try to give context for anyone listening that doesn't do EMDR. So when you're saying free associate, we really let the mind go. You said go with that, and I laughed because I have clients that say go with what too. But you say go with that, and then we let the mind go to the next place that it's going to go.
Right.
And of course, it does. In my experience, it does open up opportunities to land on something that you hadn't in your conscious mind considered before. But you're saying that that free association is something that you've really removed from the ART model.
No, people get surprised all the time about what comes up. If we try to go back to the origin. So I think that Francine Shapiro thought, according to her writing, you have to hit every tentacle or something. I say, no, you don't. The brain doesn't need that. at all. The brain needs little bits of it, and it will do the whole thing anyway. So if you're going to go ahead and free associate, you may land on something that has nothing to do with it, get too far away, almost like dissociating. And therefore, I don't think it's necessary to do most of the steps the way she laid it out anyway, And she says in her writing, if you're having a vacation in 2 weeks, don't do EMDR because they could be activated. I say do it because I want them to have a good vacation. So there's a difference here. We go ahead and do it. We hit the problem right on. And we take away the sensations and we let the brain do the work. But so often people will say, oh my gosh, I never thought of that. That's a miracle thing we want them to say. So that if I'm working with someone who is bullied, I say, take your earlier selves back. Let's do some good thought. Go back, and you take your friends today and go bully the bully or do whatever you want with the bully. And the person says to me, oh my, you'll never guess who showed up to help me. So we're full of surprises. And again, I think it's just more, the example I give is this, and you may agree or not. You go into a library, you're looking for a book. There's the EMDR stand to help you and the help desk for art. The EMDR desk says, I think it's on the 3rd floor, somewhere around there. Just let your mind go, wander, and try to find it. And the art desk says, here's the map. So the 2nd floor on the right, let me take you, I'll guide you there. So I don't know if EMDR people are going to be upset with me, but I'm telling you, this is my feeling, and this is what people think once they train. So I think there's things that Francine did that were not necessary and prolonged it. And of course, you don't want prolonged anything but a back massage. So prolonged therapy is out. I'm not going to prolong pain. Why would you if you could do it quicker?
That reminds me, our clients commonly come in when they're meeting us and say, how long is this going to take?
Yeah.
How do you answer that with a prospective ART client?
I would say it should do something the first session. Now, this is me, and I'm cocky, okay, because it doesn't work, okay? And I may say, if it does nothing the first time, I won't even see you again, because it should work for the person. If you can hold a thought, move your eyes comfortably, and be self-motivated, it will work. We have kind of diagnosis of borderline. And that is a person who likes being in therapy and may not allow it to work that well. So I created a script in the advanced training for people who are afraid to change called the fear flip. And it's done all metaphorically because people like that love metaphor. So there are past tense, present tense, and future tense in the fear. And they actually follow their future self into the tense. So we do a lot of things metaphorically because the brain in sleep does metaphor. And we're doing eye movements maybe similar to REM. So we use a lot of metaphor when we work. And some of that's really fun to do.
Can you say more about how you incorporate metaphor or how a therapist might start to think in that way?
Yeah, well, we do take an issue sometimes for, say a sensation doesn't move easily. We'll put it into a picture and work with the picture. And that has very interesting results. So pictures can be problems, and problems can be pictures. And when you do that, it makes it a very nice flow. Maybe the person doesn't want to see the real thing, so maybe you take it and put it into a metaphor. So I do interventions. I have pages and pages of interventions you can add to the script. Makes it very creative.
Yeah.
For example, you get a perfectionist, and I have them take the train to perfection, but the conductor says, sorry, no such place. We're all getting off at good enough is perfect. and they get off and they look around and they see that that makes more sense for them in that way. So metaphor is a big part of art. And if people like metaphor, this will be the best there'll be ever for them because the creativity is so right there, right in front of your face, so wonderful.
Yeah.
It's just fun to do. I mean, I don't have to work, but I do it because it's fun, at this point. So I'm 73 and I could retire tomorrow, but if I don't do art in a few weeks, I get withdrawal because I want to get that high feeling from helping people as the clients get high after each session because I believe the endorphins go up because they problem solve. They all feel lighter, in their way. So I would miss that if I didn't do it.
So in a given week, you still see clients, you do trainings, you're working on your studies, you're still doing it all.
Well, I'm pretty much from the morning right through the night. I answer questions. I do consults. I do, every month we do consults for art, and I do Inquiring Minds. So that's twice a year. I'll be doing dissociation this month. So I'll show a client who dissociates how I do it. So I'm busy all the time, and I love it. Like, it's constant, but I don't care because I really love this so much.
Yeah, I can relate to that a little bit. What is Inquiring Minds? How do you set that up?
Years ago, I decided to make something that would show different sides of art, like how do I do OCD or how do I do this or that. If it's not included in the basic trainings, the advanced and the basic, I'll do a presentation twice a year. And people sign up through isart.org. That's our organization. Well, we do the conference in April. It's coming up. And people get credentialed through isart to be, for art, to be therapists in art. And they take a test, they get credentials and all. And it does a bunch of functions. But one of them is to give you the consults for basic and advanced. I do the advanced. People come on, they ask questions, they answer them, like I do now. And it's just great fun.
Yeah. Okay. This feels like a good time to ask. We'll just start maybe at the beginning of the training offerings. What is the ground level? What is the basic training? If someone is signing up for that, what can they expect?
So if you're a licensed therapist and you sign up, you would go to the web, which is www.artworks, now.com, or acceleratedresolutiontheory.com. And you would sign up for a 3-day training. And they ask you for certain things, your license, whatever. And they're all across the country, and we're expanding every day to new places. Or come and see me in Connecticut if you want. We teach them in 3 days how to do trauma and how to do other things with a different script. Every day you get a script. And they can leave right after the training, usually Friday, Saturday, Sunday. On Monday, they can use it. And they do, and they write me, they can't believe the result. Yeah. And so, also I do a free intro every 4th Wednesday, 6 p.m. Eastern. It's on the website, way at the top left. It says free intro. You sign up. We'll get you a link. I show you people after a session and what they say. One of the things that happens with art is if someone's upset, like they've been raped, and the woman you see on the intro says, I can't even say the word rape, then she does an art session, and it doesn't feel like her word. So the trauma becomes words. So like you have words, they don't hold any emotion, and you have images and sensations. So we take those. By the end, you can talk about your problem with no problem because it becomes words and no images. So that's how it works, very quickly, which is important to me. Speed's important to me. I don't want to leave someone hanging and walking around without some resolution.
I think that is such an important element, that when our clients are coming in distress, there's no reason that we'd want them to remain with that distress any longer than they have already, huh?
It's true. It's so true.
Yeah. So it sounds like after that first 3-day basic training, you're functioning in ART. You can be out, you're seeing progress, you're implementing it, you've got what you need ostensibly for your career. That would be a good place to move from.
That's why we want to get in the colleges. So when they leave, they right now don't have very much for trauma, don't really know what to do. And so here you have the way to do it.
Yeah. And then from there, are there experientials? Like, are you trying out ART during that basic training?
So in the morning, you get the lecture and how to do it, the instruction. Then every afternoon, you do a practicum. Now, here's the thing. We do 3-to-1. Every 3 people that train get an ART therapist to sit with their group. And I didn't have that. In EMDR training, I had 30 people, 2 proctors, and it didn't go very well. So when I was crying, they called the proctor over, and the proctor said, "What's going on?" And my partner said she lost her mother in her mind. She's doing great. And she said, "What do you expect?" And she walked away. So when I worked on someone, they said, "Time's up," and that didn't go well either. So I think the 3-to-1 ratio is the difference. Here's something else we do no one does. If you're doing ISART, you get free audits forever. If you don't join, it's free the first year. So you take the training and go, "Wow, that was special. I'd like to see it again." There's no charge as long as there's room in the training to do a seat. You get to audit for free, and nobody does that.
Wow.
Yeah, I know it's really special because I want you to use it.
Yeah. Yeah. When you get out in the field with a new model, you will have questions. To be able to see it again through the eyes of someone who's using it is different.
Yes.
Okay. And so then after basic, someone could do the advanced training?
We need 30 sessions of doing basic first, so we know you have it under your belt, and then you're allowed to take the advanced. The advanced is easier. I do that on purpose because I have ways to do a session often in a half hour, but I don't want you to use that without knowing the full way. So we can get even quicker in the advanced. People love that. So. But I don't want to make it easy at first. I want you to learn it, know it well. Then I'll teach you some other skills in the advanced. If you want, don't have to take it because basic will set you up pretty well.
Yeah. And how many days is the advanced?
3. They're both 3. Yeah, and advanced, I don't use assistants like 3-to-1 because they already know the scripts, how to do them, how to read them. So they get even more confident because the groups run. I'll be there if they need me, but basically I don't want to interfere because they take the new scripts and apply what they've learned, and they can do them quite easily.
So neat. And then you mentioned that there's a credential or a certification that someone can work toward after that.
Yeah, just to be able to say you're ART certified. And after the advance, you're in ART. I always forget. There's a name, good name for if you're advanced. And that says you're advanced. But again, you take it if you want to. The basic will give you the tools you need. Though I love doing advanced. People love it. It's just all different stuff you didn't know you could do. And some of the advanced stuff is in the intro. So I have a guy who did ADHD, And 3 weeks later, 2 or 3 weeks later, he reported that things had changed. And you see that in the intro.
Oh, interesting. That's so neat to see other people applying it to different populations that they're seeing.
Right, with different scripts.
Yeah.
Now, I base the ADHD on the fact that people would take the meds. It's to speed up the brain because the brain processes more slowly. And so I figured a way to do it without meds and have the brain speed up naturally. And people like that. They feel better.
Oh, that's so interesting. Is there anyone that you've found that is not a candidate for art therapy?
Well, sometimes I joke about it and say anybody who doesn't want it. But
It's fair.
right, they don't want, don't do it. Don't force it. Again, you may have to work a little harder with someone who's diagnosed with borderline because maybe the changes are too quick because they don't expect them and they think they're going to be in therapy forever and make a friend or something. And so we don't do that. We don't need to have a big foundation with the client because when you do the eye movements and you move a headache or a pain very quickly, that's the buy-in. So you do enough eye movements, you can move many negative sensations very quickly, and the person says, wow, this worked.
Yeah.
And say, yeah, it works. That's the foundation for a relationship is that art works.
How do you explain when someone comes in and asks you what you're going, a new client, how do you explain art, or how much of a description do you give them about what to expect?
Right. So I do a half hour on the phone for free to make sure they sound like they're self-motivated, even kids. I talk to them, explain it a bit. Is there anything you want to erase, an image you don't like? And then if it goes, the way it should, they'll come in and I have a sheet that explains your brain does all the work. I'm just a guide. Just relax and just enjoy the process. You may not understand everything I say because I may try to confuse you to get into the limbic system. So if you don't understand what I say because you don't hear me, ask. But if you don't understand, but you heard me, just move your eyes and the brain will do the work. So I explain that in the handout. So they read all that first. And then I explain it more as I go along with them too. So it's very different than talk therapy. So like I had a person when I went to Florida and I had been working there and I said in Florida. And so they gave me this client, my office did, and we went in to work on her incest. And she talked and talked. And it was about 10 after, and I said, I'm going to give you a choice. You can keep talking because I can do talk therapy. I did it for many years. Or you can feel better. So what would you like to do? And she said, I want to feel better. I said, okay, let me take over. Let's do this thing I do. And she left just floating out in there and saying, what the heck was that? A lot of people call it magic. Or I will have mothers say, are you a witch? And I go, well, I'm a good witch. If I'm a witch, so it's not bad.
Linda.
That's right.
So, yeah, that's so interesting because I think anybody doing a similar modality has had that experience of someone who says they want relief but can't stop talking or maybe avoiding in some ways.
Right.
What's the youngest age that you've heard of art?
Well, I'll tell you something unbelievable. Well, first of all, we have something called SAFT, SAFT, stands for Sensation Awareness Focused Technique. So we can do something similar, I guess, to tapping, which is just move sensations. And we can teach people not in the mental health field to do that. So you have to understand that part of art could just be doing safety. Say you go down to age 4, 5, they're really young. You could do the eye movements. If they follow with the toy or something, they'll feel better. So that's a form of art in a way, a subset of art. But I'll tell you a story in the book, and it's absolutely true. So I went to do a training, and the person there hosting the training had a dog named Toby. And so when I went to pet the dog at the front, she said, no, 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 don't do that. Toby will bite you. And so I said, look, why don't you move Toby's eyes with a treat? And I'll come in slowly to bring up the fair memory. So Toby thinks about what happened. And she did that, and I came in slowly. And she said ever since then, Toby could be petted from the front. So that's how strong the eye movements are. But when you do the right amount, the right sequencing, the speed I do, so it has to be right. You can't just happenstance through eye movements, not knowing what you're doing, because sometimes it's a child's amount. Or, I want the brain to know what to expect. So the words are similar all the way through. So the brain says, I know that, and so I don't change things. I don't believe you should change things. So at first, we have people adhere to the script pretty strongly. As you take the advance, we can loosen it up. Or as you know the script really well, you can apply some of your own words. But at first, adhering to the script, if you want good results, we don't mix modalities or you get mixed results. But if you want to do a different modality, fine, do it at a different time. If you're doing an art session, do an art session, and it'll take you an hour the basic way. So that's what I say. Some of the people on Facebook don't know what they're doing. That's why you should join the consults where people know what they're doing. And so I have my partner sometimes reads the Facebook post, and I just shake my head. Or sometimes I'll say Laney says, because sometimes it's terrible. I don't know where they get that. And I think, who trained them?
Yeah. That reminded me of something earlier that you pointed out, that you specify that your trainings are for licensed therapists. Is that correct?
It's correct. I'm in a very rare case, I may make an exception, say someone's doing 20 years of therapy and they tell me the modality and they can get individual insurance for liability and all that. Very, very rarely. But if they're at the end of their master's program in counseling, we do let them do it if they're like a year away of getting the license. So we do college people because it's important. They have something like this at least, and if nothing like this, I have this to leave with.
I work with interns myself, but I always, even in talking to folks like you, I'm always excited for the ones who leave their graduate school with a firm modality that they understand forward and backward. We don't see that as much anymore. Graduate programs used to have a real designation where the students would leave really knowing something like that.
So we're working on getting in there with a couple of people. So that'd be great.
I guess on that note, for those listening that do have interns or do train associates, how do you become a trainer?
Okay, so first you have to take basic and the advanced, and then you go online and take a quick course for in a few hours called preparing for the video. So video prep. And you do a video of you doing the steps at a board like you would do them. And then if you pass, at that point, we have some states, a few where there's a wait list because we have too many trainers. But then you can take the trainer. It's in Florida, absolutely free. But you have to get yourself to Florida. Stay over for three days. I have someone that trains you in how to be a trainer in 3 days. Then you can post your trainings, and Robin Pickett is the administrator. Kathy Long does the training. Robin's a great administrator. And you would post it with her and maybe do a little PR to let people know you're in the area and you're going to be training. Have you heard of ART? See the intro if you like. And I don't make it as difficult as other modalities. I know EMDR is quite difficult to do a lot with and quite expensive. I just don't believe in it. I believe if you're going to be a good trainer in this modality, I want you out there.
Yeah.
Yeah.
Yeah. That part's really cool because it seems, I don't know, sometimes different training modalities feel a little bit like multi-level marketing where you get higher and then you're recruiting people and that's how you're making your money, and it's neat that you are welcoming people that will be good.
I should add, I think you have to be doing ART for a year to do that, but those are the steps anyway, and doing it for what is fair, and if you flunk the video, by the way, I get you. What happens is you come on live with me and go through the steps live.
Oh my God.
I want to give you another chance. Maybe you don't like doing a video. Maybe that makes you nervous. Maybe it'd be good. But I will take the people who don't pass through just to make sure that I can't kind of get what I want from you by giving you little hints. And then if you don't pass, you can wait a couple of years and try again if you do it. I don't want to lose good people if possible.
Yeah. That's really neat to hear. You mentioned PR, and that's actually something I wanted to ask you about. In the beginning, how did you start getting this method out to people? Like, how have you gotten with it where you are now?
And it is word of mouth because people don't believe it otherwise. So I feel in my art life, I have a higher power. I have something that just guides me. I can't explain it. Maybe not the rest of my life, but certainly with art, something wants it out there. So I wrote the governor, because I don't mess around. I wrote the governor when I developed it and said, I have this wonderful thing for trauma. So he gave it to the Department of Mental Health. And there was the assistant director of the Department of Mental Health, Terry Nowakowski. And she called me and said, look, we just bought something. I don't even like it, but we don't have the money for it. But can I come and see you because I have a private practice? I'm very intrigued. She came for some weekends to look over what I had and loved it. She thought it was the best thing ever. And every time she moved to a different place to open a clinic or something, she would have me in. She'd say, come and train these people. And she loved it. So she was the first one. And then I trained 2 or 3 people out of my living room. That's how they say you do it in the garage, but I did it in the living room. And I did audio tapes, not the video we show now. And they were aghast. They couldn't, it's just, what is this? And so one of the people, that's my lead trainer and BFF, Amy Schulman. So she said, don't tell anyone, but I'm quitting my PhD program because all I want to do is art. So why should I do that? I don't want to be pigeonholed there. And I said, well, don't tell people I made you quit. And then she jokes and says, yeah, Laney, who made me quit. She's a great fun, right? And so she's been with me for the 18 years. And we got into a study very quickly. Kevin Kipp had gotten a grant from the government for $1.1 million to study trauma. He studied 5 things. And his mom had sent him an article. When I thought it was the EMDR, I wrote an article and called it EMDR and didn't know it wasn't right. In fact, Francine Shapiro signed it and said, good luck. So I had a picture with Francine in my book saying she's a really great woman for getting the eye movements out into the modern world because I met her, He said, wow, I love this thing. You know, I didn't know it wasn't her thing. So in the book, you see a picture with her and me. And so Kevin got this article and called me and said, I'm doing a study on trauma. I'm not really a trauma person, but they give me this grant. Would you like to come down and speak? I said, I'll be there whenever, whatever, as soon as possible. And I went down, and the VA people were there, and they're very slow with things, you know. So one of them raised their hand and said, what if our people don't want to learn something new? And I'm thinking, I prepare for good questions. I don't find that to be a very good question, but you know, it was strange. And then one of the people came up and whispered in my ear, we don't mind new things, or I don't mind new things. I said, that's great to hear. But other people in the audience were very, very interested. And so he took in my therapy to study and said at the end, yours is the flagship. Your thing is amazing. And the average for a veteran in the study to get rid of all the trauma, including childhood, anything in war, all of it, was 3.6 sessions. It was 1 to 5, but 3.6 to make them totally okay. And so, in fact, there was a participant who didn't walk very well and wasn't doing very well. And so LaRon Nelson was working there at the University of South Florida. And a couple of weeks later, he sees the same guy walking in, just regular, no issue. And he follows him and he goes, hey, do you mind if I ask you why you're doing so much better? He said, I'm in the art study. So he went and learned art. Now he's at Yale and has had me train there because he knew about me. So he called and said, would you like to train here? And that's in my book as well, that LaRon said that. So that's how LaRon got hooked up with me. So it seems to be higher powered, like this one learns and then that one learns and then suddenly this clinic wants to train and that, you know, it grows like in a way that I don't have control over because it's word of mouth. So things come to me in very miraculous ways. My son, Josh Rosenzweig, is now COO. He's come in to fill in all the gaps of what we didn't have. You know, where do we have trainers? Where do we need trainers? Let's do a wait list here. This is fine. He's doing all the logistics. He went to MIT for supply chain management.
Oh, how cool.
And he was working 11 years for KPMG. And now he's with me and just doing amazing things. And he's just so funny because once my list of what I want to do is done, I'll be able to focus more on PR, you know. But every time he does it, there's 10 more things that grow from that. It doesn't seem to end. It's like, well, now I got 20 more things because we're talking about this. We're doing courses online we will be doing where people want to do an hour course or two on a subject. So we're going to add it for people to sign up on mini classes. So he's working on that. And that's really exciting. So exciting. Yeah.
You love getting the information out there. So having more and more opportunities to do that must feel really awesome.
It's great. It's just a really fun modality. So if you want to train, come on out. I'll put you up here. We'll train you. Right.
Oh, yeah, I'm in.
We'll have such a good time. We have a house here for people who visit.
Oh.
I'm blind.
Oh,
so it's fun. Yeah, I'll train you up.
Okay, I'm ready. Okay, is there anything I haven't asked yet that feels like it would be important for someone first dipping their toe into art?
Well, I will tell you, I do an ND for people because we don't want people to go out and train willy-nilly. Like in Europe, they're doing EMDR willy-nilly. I don't want that. So you sign an ND that says simply, I agree I won't train people in this. I'll have them go through your program. And I could be a trainer. If I want to train, become a trainer. So we don't want, if possible, so many people are doing their thesis and their papers on this. We just don't want the scripts publicized or the protocols or procedures. Everything else is fine because we have lots of studies and talk to them about it. But we just don't want to hurt people. And we don't want you to have people observe. So we just have that happen. And this guy who observed, someone let him, went out and bought tappers and made his own therapy up and doesn't know what to do if people get overly activated. So what I would say is want to keep it safe. It's contained.
Is that a European one?
Well, no, it was right here in the States. And so I talked to him and I said to the person who allowed him to watch the couple of sessions, it's unsafe what he's doing. He goes, I know. I told him not to do it. I said, well, now you're saying go back to something that doesn't work when it partly works because he made up something that he thought was similar. So we want to take care with the therapy. It's very special that people will agree, and therapists are very good with honor system to say, just don't go out and have people watch you do it because they'll mess it up. And people will be stuck. And I don't want that.
Yeah, I guess that's also what stood out to me about you liking to train licensed therapists, because I think sometimes modalities want to just train a lot of people, so they're not being as careful with who they're training, and just having that ethical foundation feels really important. So I can hear the commonalities of you just trying to provide safety to the clients who will be the
In fact, you can't sign up if you're not licensed. And if I do make a really, really rare case, it's because they couldn't sign up. So we know because we had certain things. There is a not-for-profit rate with 200 off, and you have to prove you are not-for-profit. So we wanted to do that.
Yeah, that's great.
But it's such a good training if you don't have tools for trauma that work and work quickly, because people can't tolerate a long treatment of that. And that's not fair to put people through it. Then this would be the way to go.
Yeah, that sounds great. Okay, my last question I like to ask everybody, what do you, and I think I already know your answer, what do you do or recommend for self-care?
Well, we can do self-use of the eye movements, but just for sensation moving, not for a scene. I can't do a scene on myself. So it would be only safety, like turn your head, move a sensation, go down through your feet. So yeah, you could do that. You could also go to an art therapist.
Yeah.
And just have them work on you, because people do that all the time.
Yeah, how about clear out some of the...
Oh, yeah. I mean, for sure. Yeah. So what's than art to get rid of?
There you go. I love it. Well, Laney, thank you so much for your time today. This was so much fun.
Thank you so very much, too.